Hi, everyone. This is Lin Bouthillier from linbouthillier.com. I'm a certified trauma recovery coach, and I'd like to welcome you to another episode of my ongoing series entitled Monogamous at 13. This is my dual perspective of my own trauma history, my own trauma story, for the purpose of sharing with my viewers, with my subscribers, a dual perspective on trauma. So I share with you myself as my case study, and then I look at whatever I've discussed for that day, whatever situation, whatever trauma topic we're discussing, and put on my other hat as the opposite of the trauma survivors, the trauma professional. And so I have dual perspective, and I love to share that with you so that you can have more insight into your trauma, into the ways that you process the things that you process on a daily basis. So as with all of my videos, there is a trigger warning on this video, and this is the trigger warning right now I'm sharing with you. Please be advised that I'm speaking about traumatic incidents, traumatic occurrences, traumatic, whatever comes up, whatever experience that I had that I'm speaking about, it's going to involve trauma, and therefore it could be triggering for certain feelings and emotions. And I have a little grounding stone in my hand, and I strongly encourage you to have some grounding tool either near you or in your hand, something close by that you can use if you begin to feel that you need to reestablish the connection between your brain and your body so that you can feel grounded. And this way we mitigate any of the feelings of unsafety that could come to us while we're doing a little bit of trauma work together. So with that, I will begin. Please take very best care of yourselves, and please notice what comes up for you. And if at any time it begins to feel like this is too much, please shut it off and go about your day and give yourself beautiful, wonderful self-care for the rest of the day if that happens. It's a good idea to do it anyways. All right, so I'm going to share with you an incident that I had, and it started a couple of days ago, but I'll catch you up to how I got to this moment that I'm going to share with you. And the discussion is going to be about the connection between an incident that happened to me, which caused me to need some medical attention, which caused me to feel some shame. And I want to share with you again the connection between what happens to us, how we process it, and where does shame come into that spectrum of occurrences. When we understand a little bit more about how deeply we are rooted to our shame, the more we can understand our own trauma recovery. And shame is a giant piece of the trauma recovery puzzle. So I'm going to demonstrate that for you today using my own life experience that happened just hours ago. Okay, so here it goes. It starts with a really nice day we had in upstate New York a few days ago. Many of you already know that I have two beautiful little dogs. They're older dogs, and they're how do I say this? They are quite content with a slow speed walk on a nice day. With their, the being in advanced age, especially one of them is close to 13 years old. They don't love to be out in harsh weather anymore. They did for years and years. They didn't mind that, but now older dogs, on a day like today where it's just a steady drizzle and it's cold out, it's kind of a downtime day for them, which is kind of nice to have sometimes. But anyways, a few days ago, upstate New York was having just amazing, beautiful weather. And for mid-November, for us to be getting a 60-degree day was just too much for me to pass up. So I took my dogs out on a really easy trail. I have spine issues, and it is a less challenging trail that I do now because of my spine issues. I'm kind to myself that way, not to push myself to do more than what my body can take. So we were on that trail, and we took a lot of stops, and it was beautiful. Took some photographs out there. We were up on a gently rolling hill. It was just absolutely beautiful. The scenery was gorgeous. My dogs had a ball, and we were out there for about 2.5 hours. And I took a lot of breaks because I do from time to like every 20 minutes or so, I do stop. And if there's a place for me to sit down, I'm kind to myself. I let my body recover a little bit, and then we do a little bit more. So I was taking care of them and taking care of myself and being compassionate with my own body and my own limitations, embracing them and being just partnered with myself, being aware of how I feel, but still having a wonderful time. But when I got home, I checked my dogs for ticks. We have a lot of ticks where I live, and in the woods, in the meadows, there are ticks. And my dogs did not have any. I checked them really thoroughly, but I forgot to check myself. And this walk happened on Wednesday of this week. And one of the things that happened was that I didn't check myself, but I went to do a couple of things. I had taken a shower. Here, pause for a second. Okay. So we're back to quiet again. So where I left off was, this is crazy. I've taken like, I don't know, maybe 6 showers since the time that I was in the woods. I've gone swimming 3 times since I was in the woods. Actually, no, I'm gonna back up twice. I went swimming twice, had somewhere between 5 and 6 showers after that hike. And I still never noticed that I had a tick on me, and it wasn't just on me. But by the time I found it last night, 3:30 and around 3 o'clock in the morning was when I found it. I was extremely alarmed that I had this thing, and it was a good sized tick, and it was completely embedded. Like there was almost none of it sticking out of my skin. I could see it under my skin, but it was in a place where it was very, very, very hard for me to see it. And so it was on the top of my thigh. And so the first thing that happens when you find out a tick, if any of you have experienced it, you'll know what I'm speaking about. The revulsion that we feel, the audacity of that thing to be a parasite on our body is extremely emotionally disturbing for some of us. There's some people who it kind of rolls off of them, if they might be an experienced hunter or hiker, and they might be like, yeah, I have a tweezer, I pull it out, I kill it, it's over. I don't really give it another thought. And some of us are completely grossed out. Some of us are offended. We feel violated. We feel like this thing has invaded us and it had no right to do so. And now I have to, instead of going and getting in my nice warm bed and going to sleep, now I have to go someplace and have medical treatment because it's in my flesh far enough that I am not comfortable with breaking open my own skin and getting it out. And then I'm worried, what if I can't get the whole thing out? And a dear friend of mine told me exactly what to do for it. I mean, calm as can be, told me what to do to get that tick out. And I said, you know what? I'm gonna go and have a medical professional take care of it. And the reason that I did that is another thing that for me is a little bit related to my trauma. And that is because I had a splenectomy in 1981. I don't have my spleen anymore. And I am very, very concerned if anything like that happens, because ticks are known for carrying Lyme disease. And if we have a compromised immune system, we can also pick up an infection from something like that, but also Lyme disease infection. So I've had a tick before, and I happened to be hospitalized at that time in 2021 for a kidney stone. And I told them just before I came here, I pulled a tick out of my flank. And I don't know what I'm supposed to do, if there's supposed to be some treatment for it. And they said, oh yes, there's treatment for it. We're going to order an antibiotic for you. And, there's a certain protocol we follow, which is you watch for the bullseye rash. What that means is there's always redness and inflammation around a tick bite, but watch it for a couple days. And if you start to see a ring that's around the perimeter of it, but not touching it, it's a little bit distance out. That is one of the symptoms of it being, a Lyme disease infection. So I had to watch it for that, but they gave me the antibiotic and said the chances are extremely low that you will develop that. So last night I had to get in my vehicle and drive to a hospital. It's about 25 minutes away. Go check myself in, and I have to go in there, and at the triage desk, they asked me, what are you here to be seen for? And I said, I have a tick embedded in my right thigh. And they said, okay. And they got my information, said, have a seat. You came at a really good time. It turns out 3:30 in the morning was a really, really good time at this particular hospital because nothing much was going on in the ER at that moment. There was no big, huge, full overflowing group of people that needed to be seen. So they took me back right away. And a PA came in to see me, and he said, we're going to get this taken care of for you really quick. You'll be out of here in like 5 minutes. And I said, okay. And then this is the part that if it's not, it's mildly traumatic to have an insect take up residence in your body. And then for it to be one of those things where there's other issues involved and you can't just handle it yourself at home. So there's some inconvenience involved in this. There's some hard feelings involved in this. There's the feeling of just being completely grossed out. And then it hit me. I got to drop my pants. And this guy's going to get this thing out of my leg. But when I say upper thigh, you might remember an episode of Everybody Loves Raymond. And it's the one where Robert he's the police officer, one of the brothers. And at his regular workday job as a police officer, he got gored by a bull. And the bull got him in the groin. And every time, the running joke in this half-hour episode of Everybody Loves Raymond was every time somebody says it got him in the groin, Robert yells, upper thigh. Well, this thing got me in the upper thigh. And it was embarrassing for me. And the question from the nurse was, why didn't you just pull it out at home? And I said, I had to say out loud, because of my obesity, I cannot see the tick. I can only feel the tick. I tried to get a look at it. I even used my cell phone trying to, angle it in a certain way where I can see it on the screen. I couldn't do it. This is the part that's traumatizing for me. If it isn't traumatizing enough to have a parasitic insect burrow into your flesh, the next difficult part for me is that I have to say to these people, I couldn't take care of it at home because of my obesity issue makes it so that I cannot see that part of my body. And so as a trauma survivor, as a trauma professional, I'm thinking, how many people are like me that will even consider avoiding going to get emergency medical care or just, routine medical care because of the shame that we carry for the condition of our body. So when they asked me at the triage desk, well, why didn't you just take it out? And I said, I couldn't. Because I can't, if I can't see where I'm tweezing, I can't tell if I won't be able to tell if I got the whole thing. It needs somebody to be up close looking at it and making sure that they got it. So I didn't go into a full-blown panic attack or anything like that, but I was starting to panic on the inside because the PA was a very nice young gentleman. And he said to me, we can do this one of two ways. You can either stand right here and just lower your pants and I'll get it for you. or you can just lower your pants and lay on the bed, just lay on your back and I'll work that way. It's up to you, however you're more comfortable. And I said, well, I'll remain standing if that's all right with you then. So I did. And then the third thing hits me that is really, really difficult to speak about. But because I'm a certified trauma recovery coach, I want to speak about the things that the people who have trauma out in the world actually experience. I want to speak about the moments that we have where we go into panic or we go into such a shame spiral, a feeling of, dear God, anything but this is so embarrassing. This is so shaming. I hate this. Because it suddenly occurs to me, this guy's face is going to be level with my nether regions. And I cannot bear the thought of that because I'm thinking, what if I smell bad? I'm thinking, what if he's so grossed out that he has to do this as his job? And this is how he spends his time, and this is what he has to do. Yes, he's a medical professional. He went to medical school. He had to deal with every kind of awkward, gross, awful situation that could ever occur in a medical environment. Yeah, I worked in a hospital. I saw stuff that I probably will never speak about to anybody because it was just awful. But here I am standing there thinking, it's only going to take 5 minutes, he said. But that 5 minutes now feels like 5 hours to me because I cannot stand to be in this uncomfortable, vulnerable, humiliated situation. It just felt like too much for my nervous system. Well, the nurse that was standing, he was saying, you know, I need more light. So she goes over and she gets a light off the wall. And he said, you know, it's so hard to see because it's embedded, and I have to get a really good grip on it when I pull it out. And he wanted like a magnifying a set of magnifying glasses. So he's got the glasses on and she's holding the light. And he's saying to me, this thing just doesn't want to let go. And he said, I don't want to tear it and have to dig to get pieces out. But he got it out. And he said, I'm so sorry. One of the legs broke off. It's still in there. It'll work its way out like a sliver. You don't have to worry about it. It's not going to do you any harm. And I think that he was aware of my level of discomfort at just having to be in that situation with that level of vulnerability. And so the only thing that this compassionate man could think of to say was, do so. When it was all done, he showed me the tick. He said, well, here's your tick. It's missing one leg. That's still in your skin. It'll come out in a couple days. Don't worry about that. And he said, we're going to give you an antibiotic before you leave. So don't worry about that. You won't have to get a prescription from your pharmacy. And do you want to see the tick? And I said, sure, why not? So he's holding it on a little piece of cloth on his hand. And he says, well, here it is. And he said, they are gross, aren't they? And I said, yeah, they absolutely are. And he thought for a minute, and you know, he had to use a little tiny, a little scissor about this long, because the flesh was, over the bug. There was only just the tiniest little piece of the bug sticking out. Like over 90% of the bug was under the skin. And he had to make a little opening for him to be able to get his tweezers in. And so when he did that, he said to me, this is going to sting. It's going to hurt a little bit. And I said, oh, I got a grounding tool with me. I had one in my pocket. And I said, I grabbed it on the way out the door because I knew I would need to ground myself during this. And it's fine. Do whatever you got to do. I'm going to be fine. Don't worry about me. And so he said, it's going to sting. And I said, all right. It's okay. I'm glad you told me. Thank you. Well, it did a little bit, but when he was all done, he says to me, do you sew? And I said, occasionally, but I used to do quilting, but I kind of set that aside for a while to do other things, meaning this, being a trauma coach. And he said, why don't you take the scissors? He said, I'm going to just look the other way and you can have the scissors. He said, they're really nice scissors to have if you got a first aid kit or a sewing kit. They're really, really nice. And I said to him, well, I appreciate that. That's very kind. Thank you. And it took a second for it to click with me. What is he talking to me about the scissors for? Because this man is absolutely 100% understanding that this lady who just had to undergo this experience is traumatized. He absolutely knew that my trauma was based in shame. And he was trying to offer me something to show me that he accepted me and he saw me as a person worth talking to. And he saw me as a person, a complete person who is in possession of a set of feelings and emotions. And so the nurse said, yeah, why don't you take the scissors? She said, it'll be a nice memento for you. And I thought, I worked in an emergency room. I have never, ever heard anybody, medical professional, offer a patient the scissors that were used for their procedure. And I knew right away, this isn't something that is normally done. I've been through lots of procedures in emergency room with, as the nursing support that's in the room. So I knew right away what this was. He's trying to make what we call, the trauma professionals refer to as the interpersonal bridge. He's giving me the interpersonal bridge, which means I'm offering you that you are safe. I'm offering you that I see you, I hear you, I feel that you are a real human being who has real things about them that are involved in their life. So I'm not just seeing you as a thigh that came in with a bug in it. I'm seeing you as a lady who might sew. I'm seeing you as a person who might have a hobby. I'm seeing you as an individual who might like to have a really nice pair of scissors. And he was letting me know, we are not dwelling on this humiliating experience for you. It's all okay. And you did fine. And we still think you're worth speaking to. And we still see you as a worthy human being. They know, I know beyond a shadow of a doubt, they know that they were with a trauma survivor. They had to have known because of that. And it wasn't a fawning response that sometimes we see where somebody who is traumatized will fawn over somebody else and try to caretake them in kind of an over the top sort of way. That's to gain their safety in a situation. It's what our nervous system naturally does when we have something traumatizing happen to us. But the physician assistant was not the traumatized person in that situation. I was. And so he wasn't having a fawning response to me. He was having a human connection response to me that we refer to as the interpersonal bridge. I believe that's from a psychiatrist named Gershon Kaufman. I believe that's from his work. One of his books is, actually two of his books are behind me on that shelf. He wrote a book called Coming Out of Shame, and it is about, it's a book that was written for and about the LGBTQ plus community, and how we come out of ways that we can recognize that we are in a state of shame and ways that we can bring ourselves out of that through, self-compassion and a few other things. But I knew right away, this person is establishing the interpersonal bridge with me and letting me know, we see you, we hear you, we feel you, you matter. And we want you to walk out of this room with dignity. We want you to walk. My question to the guy was, well, don't you guys have a autoclave or something like that sanitizes these things? I don't want to take hospital equipment from you. He said, we'll be okay. He said, how about this? I'm going to turn around and I'm going to stay like this for a minute. And when I turn back, if the scissors are gone, I didn't see a thing. And I said, okay. So I have those little scissors in my side pocket of my tote bag. But I wanted to share that with you today because it showed me that there are people who work in unexpected places. They are trauma informed. There's no doubt in my mind. I was dealing with a trauma informed PA. And as a trauma professional myself, if I could have, I would have done a cartwheel all the way to the car. I was so absolutely over the top pleased with how I was treated in that environment. How many of us go to a place and have something happen to us where we have to reach out for help from somebody? And on top of the pain, the fear or anger or trepidation, humiliation, the angst, the panic that we're feeling, on top of that, someone doesn't mind giving us a portion of shame, like getting out their shame thrower and pointing it at us and wham, right at us. But these people did not do that. They didn't laugh about it. Nobody made a remark like, oh, what a creepy place to have to get a tick taken out. None of that. Nothing like that. Just complete and total respect and dignity, and making sure that I understood that person was aware of the interpersonal bridge and knew exactly when to implement using it, to make the connection, to put my nervous system at ease and let me know there's nothing here that you need to carry shame for. And I said out loud, I'm embarrassed because with my obesity issue, I can't see that part of my body. I can't see it. And it was really, really hard for me to say that because I've been judged many times, just like many of you. And then we have a wound from that judgment, a hypersensitivity to that kind of judgment, and then an all encompassing pervasive fear of having that embarrassment exposed. We can just live our life not really aware of it consciously until some little thing happens, like some little tiny bug out in the world that decides to embed itself into our skin. And then there it is. We're right back to, oh yeah, that bugbear is still there. I still have this issue. I'm still carrying this shame for my self-image, for how I see myself, for how I worry that the world sees me and judges me. So let's talk a little bit more about what this comes from, what that fear of judgment comes from, what that shame comes from. It's a few things. One of them is where the book that's on my shelf in the blue section right there. It's called Complex PTSD from Surviving to Thriving by Pete Walker. And Pete Walker is the practitioner who gave the world the wonderful gift of the concept or the model of the inner critic and the outer critic. And so my inner critic was screaming inside, no, we do not want to be this vulnerable. They're going to criticize us. Even if they don't do it out loud, they're going to do it in their head. They're going to be thinking thoughts about me like, man, what does she eat every day? Holy cow. How could she not care about her health? How could she let herself get this out of shape? How could she not even know for 2 days that she's got this thing embedded in her skin? What's the matter with her? That's what we worry, that in a situation like that the other people that we have to deal with are going to have going on silently inside of them, that they're going to be silently judging us and criticizing us. And so our inner critic will start going, yeah, you should be ashamed. On some level, they're right. They would be horrible to say it out loud to you, but I know they're thinking it. They would have to be thinking it, right? They must be thinking that they don't even want to touch this. They don't want to be in that position, to be that close to you in that area, all that stuff. So my inner critic was terrified of what an outer critic might, somebody outside of me might be thinking or saying out loud, or even gesturing to another person, like eye rolling and sighing, or, this kind of look. That's one of the things that's an issue for us, okay, is that we are always dealing with inner critic and outer critic. And we can learn a little bit from reading Pete Walker's book, Complex PTSD, From Surviving to Thriving. I can't recommend it enough to trauma survivors. It's an incredibly wonderful book, and it is for free on YouTube. He made it available on YouTube, and it's an audio book. And some people are not nuts about the voice, that reads the book to you. But I prefer to listen to a book when I'm sleeping, to really get that information in, and then to read it in print while I'm awake. I like to utilize both. But if we want to understand a little bit more clearly about inner and outer critic work, that's a great resource for you. Okay. So that did help me. Having that knowledge and understanding did help to ground me during that, where I'm just saying to myself, while he's working on my leg, I'm going, yeah, my inner critic is having a very hard time with this. She is shaming me very severely right now. And I recognize it. And I recognize that all that is the inner critic who's been there since my childhood. And it will be there with me until I leave this world. It's part of being a human being, and it's what our brain and our system does. Our organism does dialogue inside about that, and it does worry about what somebody from long ago might have said to criticize our weight. Like with my father, when I was around 10 years old, and my father brings me home from shopping for a winter coat, and we couldn't find one that fit. So we walk in the door, and he says to my mother, okay, he says, Eloise, he's got me by my shoulders. He's behind me, and he pushes me toward her. He says, get this kid on a diet. And that little girl who experienced that wound is standing in that medical exam room in a hospital at 3:30 in the morning, hearing daddy's words, and thinking that must be what the PA and the nurse are thinking it has to be. She needs to be on a diet. Look at this condition of this person. How awful. So the inner critic can be the voice of someone that was from long ago, but our inner being has all of that collected in there. And so we can think that it's the outer critic of the physician or PA that's right in front of us. But if we look at it really closely, it's my mind projecting my father's words onto this person that's right in front of me, that actually holds most likely no opinion one way or the other. He's just at work trying to get a really icky bug out of a nice older lady's skin for her in the middle of the night or wee hours of the morning. When we take it apart on the table and look at it with our rational mind, not our emotional mind, we can see that the likelihood of that person actually going into the role of being an outer critic is pretty low. It's really not that likely to be happening. But my past experiences that are really deep down in my subconscious and maybe a little bit up in my consciousness are going to just kind of be like a runaway train. And I'm in a stressed experience. I'm in a stressed mood. I'm in a place in a time when I don't want to be there. I do not want any detail of this whatsoever, except for now that I am in this vulnerable situation. I'm really glad that these two compassionate people are right here in front of me to help me get out of this jam, because they did. And they did it beautifully. They did it as in a high quality way that was just amazing. It was great. All right, so what else is going on with the shame part? Well, I have this book that I'm more than halfway through reading now. It's called Embracing Shame, and I've mentioned it a few times in my videos, and it's by Brett Lyon and Sheila Rubin. The subtitle of the book is How to Stop Resisting Shame and Turn It into a Powerful Ally. Well, at the very beginning of the book, there is something that I highlighted in here because this is one of the most important things in the entire book so far. Okay. It says, in our work, we often talk about the 90-10 split. As a rule, when something relatively small kicks off a powerful shame reaction, like getting a bug in your skin and having to go to the ER, 90% of that is due to past experiences, and only 10% is coming from the trigger itself. That's not always the case, of course, but it's almost always true that strong shame experiences have to do with things we had to live through as children. So here is 61-year-old Lin experiencing shame and humiliation and angst, trepidation, just feeling completely vulnerable and completely in a I'm about to be judged really harshly right now situation. And 90% of it most likely was from the subconscious stuff that I'm carrying from my childhood and having very little to do with the fact that I just needed help getting a bug out of my skin in the middle of the night because I took a hike and didn't know that I had picked up a tick a couple days before. And so I wanted to share that with you because one of the most compassionate and loving things that we can do for ourselves as a trauma survivor is to understand shame. We truly need, just like we need nutrients from our food, we need to breathe clean air. We need to wear clean clothing and dress appropriately for the season. And we need to have our recreation. We need to have a safe place to live. We need to interact with our pets. And we need to have all of these different comforts in our life that contribute to us being healthy. Some of them are absolutely essential. Well, understanding, having just the most rudimentary, basic understanding about shame is essential for trauma survivors, for abuse survivors, for any person who carries trauma inside of them that has relational, emotional, psychological, biological, and neurobiological after effects. It's important that we understand that because one of the biggest kindnesses that we can do for ourselves, one of the absolute best ways that we can partner with ourselves is that when we have an experience, we can ask ourselves this question: is this experience upsetting to me or uncomfortable to me or humiliating to me? Is it unbearable to me? If it is there a shame component that has nothing to do with this moment, but might be in part of my internal luggage that I'm carrying around that contains lots of different scenes from my childhood where I was being shamed, where I was being abused, where I was being mistreated, and where I was being disrespected and degraded. And we might find that a whole lot of what we're experiencing right now isn't about right now so much. It's the little thing or the bigger thing that happened right now that launches us like a catapult right back into the past. But sometimes we don't have lots of pictures and images to let us know that it's from the past. It's just feelings. And when it's just feelings with no video inside of our mind to take us directly to that causation, it can be confusing. It can leave us kind of scratching our head and then wondering, what is wrong with me? Why am I responding so intensely, if the problem is this big, why is my response this big? And it might have to do with our shame and our inner critic and our outer critic. So 2 excellent books for you if you have any kind of developmental trauma or what we call adverse childhood experiences, anything that happened in your long ago past that's still active within you, that really kind of fuels and feeds your shame in your now life. When something like what just happened to me comes up, excellent place to begin is purchase a copy of this book for yourself if you can. And if you can't, you can go to your library and request that they get a copy and hold it for you and notify you when it comes in. But again, it's called Embracing Shame by Brett Lyon and Sheila Rubin. It's a brilliant book, and it's just the best thing I've ever read in my life about shame. Okay, the most useful stuff, easy to digest, very nicely broken down information that helps trauma and abuse survivors understand their shame. I have enjoyed this conversation with you very, very much. If you enjoyed my work, if this video helped you, please hit the like button. If you wouldn't mind, please like, subscribe, share, hit the notification bell, put comments in the comments section. I absolutely love the dialogues that appear in my in the comments section for my videos. And I have great appreciation for you coming back. If you're a returning viewer, and if you're a new viewer, welcome. I'm so glad that you're here. Please feel free to share any of my material on any platform where you think it would be appropriate, where it would help other people. All of your shares really mean the world to me. So thank you very much, very, very much. I appreciate that. It helps my little channel to grow and to help more and more people in the trauma and abuse community to recover. And that's the ultimate goal. I'm just trying to put information out in a relatable way that helps people to be able to recover from their trauma and live their best life free of the constraints of trauma. So if you're interested in working with me as your certified trauma recovery coach, I would love to be your co-equal partner in self-led or client-led care. And I can have a discovery call with you if you're interested in that. You can reach me through my website, which is linbouthillier.com. You can email me, lynn@linbouthillier.com. My phone number is 716-994-3052. And I am delighted to receive phone calls from anybody who is interested in learning more about how certified trauma recovery coaching and working with a CTRC can help you in your own personal trauma recovery journey. And it would be such an honor and a pleasure to work with you on that journey. So thank you again, everyone. Have the very best day. And please, this was a little bit of a disturbing talk. Please, please, please give yourself excellent self-care for the rest of the day. It's super important that you do. Self-care is never, ever selfish. It is essential to trauma recovery, and you are infinitely worthy of your own trauma recovery. I'll see you next time.